Hey y'all, welcome to episode 3 in my series of pregnancy options you may not have heard of before. These are just some topics I want to try to shed some light upon for first-time moms, second-time mom, third-time moms. I'm a third-time mom here, and some of these things I am still learning myself. There's just some topics that aren't readily discussed and talked about very much in the pregnancy, birth, health sphere of today's society. So I'm just trying to bring some light onto those, kind of just let you know your options in pregnancy and birth and let you make an informed decision. Of course, always do your own research. I try to leave as many links in the description box below for you to delve into these topics yourself. I just kind of want to present the facts and jumpstart you to start thinking about some of these topics, researching them for yourselves, and making the most informed decision that you can for you and your baby that you're carrying. So if you're new here, my name is Amy. I'm a mama of 2 with a 3rd baby on the way. I'm 26 weeks pregnant, so just finishing out the 2nd trimester. So this video will kind of bring some light to the things that you will kind of encounter into the 3rd trimester. That's kind of where I'm headed now. So I'm just kind of following this series along with my pregnancy, and my next video will probably be closer to things you can focus on, options you may want to be thinking about before you have your baby, before you go into labor. So I hope y'all have been enjoying this series. Let me know in the comments below if there's anything specific you want me to touch upon, or if you just have any other general questions, I'll be happy to answer them in the comments below. Be sure to give this video a thumbs up, subscribe if you're new here, and let's go ahead and jump right in. So we'll start out with one a little bit on the lighter side, and then we'll get into some of the heavier topics. So first of all, start thinking about who you want to be present at your birth. If you're nearing into the 3rd trimester, you're kind of getting your mindset more ready for birth. You may have already decided who you want at your birth, but if you haven't, now's probably the time. If you're going to invite lots and lots of people, go ahead and let them know to be prepared to come to your birth. If you only want one person, your husband, your mom, your grandma, if you only want a few specific people in there, you need to be letting everyone else know that you don't want them in your birth and labor, and that's kind of a private time, and you just want a few specific people. So be letting those people know kind of ahead of time. So if they are a little disappointed, or if they're really excited to be there, they can go ahead and be planning ahead for that time. So it is your birth. You have the choice of who is at your birth. You make that decision. That is your choice, your option. Talk about that with your husband, who y'all want at your birth, and go ahead and be letting them know. So next thing I want to touch on baby's positioning. Around the 20-week mark, many mamas have an anatomy scan, and that kind of goes ahead and lets the care provider and the mother know what position baby is in. There are other ways of doing belly mapping and learning baby's position. I talked a lot about ultrasounds in the last video. That is another choice option you have. If you've had that ultrasound and maybe they told you baby was breech, or side lying, or in a weird position facing anterior or posterior, depending on the position, they may be preparing you, depending on your care provider, they may be preparing you for other options for labor, for delivering the baby, such as if many care providers will not deliver a breech baby, there are complications that can arise. There are care providers that will, so you make that decision there, what choice you want to make. But if baby is breech at this phase in pregnancy, first of all, there's still plenty of time for baby to settle into the correct position, especially at 20 weeks. But if you're nearing on into the 3rd trimester, many times mamas get a little bit nervous if baby is still lying breech or laying side lying in that kind of football position across your belly horizontally. So around this time is when baby will start to be settling into its position. So you really want to make sure you're balanced out. There are exercises you can do. I will link some down below from the website Spinning Babies, where you can kind of help baby get into that optimal position. So right now, this early into your pregnancy, not even close to the 40-week mark, do not be stressing about options you have if your baby is breech. There are ways you can flip baby. There are ways you can turn baby. There are things you can do, and some babies even turn in the last week or 2. Some babies even turn during labor, so don't stress about that. You do have options. I would be looking on the front end of them at options you have to help baby maneuver into the correct position, and there are tons of resources for that on the Spinning Babies website. I'll link it below for you guys. But just know that if your baby is breech right now, C-section is not your only option. There are so many ways, so many options you have to help baby get into the correct position. You just need to be proactive on the forefront, which is now. So be thinking about that. If you've already gotten that decision told to you that, oh, your baby's breech, you're gonna have a C-section. No, you don't. It is your option, your body. figure out how to flip baby, help baby, or find a care provider that will deliver breech babies, that is not scared of that, because that's not a huge indicator right there for a C-section, as many providers will tell you. So piggybacking right off of that, if you have happened not to have had ultrasounds and you still know baby's positioning, there's something called belly mapping, where you can kind of map out baby's position. You kind of just have to be very aware of kicks and maneuvers and positions in your belly. So I personally have opted out of ultrasounds this pregnancy, so we will be starting to do some belly mapping here in the next couple of weeks to kind of figure out baby's position. I may actually include a video on that. That would be really cool, kind of to show you how to do some belly mapping. If you are not having ultrasounds and you really want to know the position of baby, your midwife or care provider can definitely help you with this. I plan on having my midwife show me a little bit in my next appointment, a little bit more in depth on belly mapping, but that is another option you have if you are opting out of ultrasounds, or if you've had some ultrasounds and you're just not comfortable with having any more ultrasounds later in pregnancy. Belly mapping is an option you have to help you distinguish what position baby is lying in and what kind of things you might start doing on the proactive side to help baby get into the optimal head down posterior facing position. Okay, so I already touched on this one in a previous video, but I want to touch on it one more time because it does come about here at the end of the second into the third trimester, and that is gestational diabetes testing. So first of all, you do have the choice of, do you even want to do this test, yes or no? This is one that I think is a little more on the important side as far as testing, because if there is something going on with your blood sugar, it can cause issues with the baby. It can cause issues for the mama's health. So do your research on the gestational diabetes testing. But again, if you don't feel inclined to do so, you are not obliged to complete this test. Many providers will tell you that it is protocol, but protocol does not mean it is required. It may be protocol for them, but if that's their protocol and they don't want to go along with what you want to do, I already mentioned this in the first video, but you can fire your provider and find a new one who fits more along with your values and aligns more with your values. As far as gestational diabetes testing, there's basically 3 options of tests you have. I'd go into more of these in the first video, which I'll link down below, but those are the glucola drink, the fresh test, and the at-home finger prick test. All of these will basically just test your blood sugar levels, I can't say that word today, and see if there's any issues with the foods you're consuming and there needs to be anything that's tweaked. So the glucola drink is the most common one, the one that most OB providers do in the OB office. I did that on my first till I really started delving into the ingredients. If you saw my first video, I go more into depth on the ingredients in the glucola drink. And if you are a mama who is very aware of things that she puts in her body and things that her baby is consuming, this may be one you might want to research and think about a little harder, maybe talk about with your provider what other options he or she may offer. So that's the most common one, the glucola drink. The next one is called the fresh test. This is the one that my midwife personally offers in her midwife office. It's basically like a form of glucose that you drink with water and then test right after. So it's very similar to the glucola drink, but a lot less harmful, preservative, toxic-filled ingredients that's in the glucola drink. And the third option is the finger prick test. This is the test that I personally did with my last pregnancy and will be doing again with this pregnancy here in probably the next week. I will have a full detailed video coming out taking you along for every step of the way on how I do my at-home finger prick glucose testing. So stay tuned for that. It's coming out very soon. But that is the one that I believe most accurately gives you the best depiction of your blood sugar levels, because you're actually testing for a 2-week time span after your breakfast, lunch, dinner, and at your fasting time. So you're getting a very accurate representation of how your body is reacting to the certain foods you are eating over a time span, not just a one-time snapshot that you get with the glucola or the fresh test. Again, I go into a little more depth on that one in my first video, so if you want a little more knowledge on the 3 options, check that video out. I will link it down below. All right, leading into another test that you'll be asked to do or asked to partake in the 3rd trimester, and that is the GBS, the Group B Strep test. So this is another one, completely optional, and if you do happen to get a positive test result, what you do as far as the protocol for that positive test is, again, your option. So I'll just kind of give a little insight what it is. Group B strep is a bacteria that lies in the birth canal of some mamas, and when babies pass through, they can contract the Group B strep virus and it can affect them after birth. Some babies aren't affected at all, and some babies are affected very severely. So this is something you need to weigh your options on. I would link some articles down below on evidence-based birth where you can read more about Group B strep testing and the protocols for it. But Again, this is optional. If you get a negative test at 30 something weeks, you can easily be positive again at 40 weeks. This is something that can come and go. So I did test for this my first pregnancy. Thankfully it was negative. My second pregnancy, it was also negative. But if it had been positive in my first pregnancy, my OB care provider would have required me to be on antibiotics all throughout my labor, like prior to my baby being born. And antibiotics are just a whole nother realm of research you probably need to research into, and that's just not something I was comfortable with. So thankfully it was negative. This last time my midwife gave me options if it had also been positive, but personally for myself, I like to just kind of take a more proactive approach for group B strep. So there's a kind of a protocol I take of a few supplements, food supplements that I will start taking here probably in the next 4 or 5 weeks, just to kind of be on the proactive side of preventing group B strep. And I will again share an entire video on my group B strep protocol probably in the next couple of weeks when I start that, so stay tuned for that one. But for me personally, if I had the group B strep test and it was positive, I would still opt out of antibiotics. I would treat it in a natural fashion because I believe that antibiotics are more harmful than they are good. This is my personal opinion here. I try to keep my opinion out of this, but this is just one I do want to share with you guys. So I will, whether I'm positive or negative, I'm going to treat it like I'm positive. So going into this, I know I'm going to treat myself like I'm already positive, and I'm going to do a protocol because I'm not going to opt in for those antibiotics if I was positive from my midwife or an OB provider. So that is just something you'll have to weigh the odds on for your personal health, your personal choices. Again, I'll link an article from Evidence-Based Birth on group B strep so you can read all about it. Choose your uninformed option, what's best for you, but that's kind of what I take, the kind of action I take. Many providers will tell you that this is protocol and that it's required, but again, your body, your choice, your option. Make an informed decision for yourself. And the last one I want to touch on is early induction because of fluid levels. Again, I will link an article about amniotic fluid levels if you want more research on this, but this is one that's kind of very personal to me. In my first birth, we were told that we had a low fluid and that we needed to induce at 36 weeks. And I was like, wait here, pause a minute. I'm only 36 weeks and you're just telling me I have low fluid and that's an automatic reason for induction at 36 weeks? I mean, my baby's lungs may not even be fully developed. They're like, yeah. And I was like, well, we can at least get a second opinion. So again, make an informed decision, but from the research I have done, a little bit that I've learned about it, amniotic fluid is continually replenishing itself. And at a certain point in your pregnancy, mama is not producing the amniotic fluid that is coming from baby's urine and mucus secretion. So if baby is not having quite as much urine that day, your amniotic fluid is going to be a little bit lower. Now, I'm not giving medical advice here because there can be reasons for baby not having enough urine. There can be medical reasons that arise. So definitely be informed here. But just an automatic, them telling you, oh, we've got to induce, baby's fluid's low. I just don't think that's enough of a reason, especially without a second opinion. Come to find out, we went and got a second opinion after that ultrasound in my first pregnancy. Amniotic fluid was perfectly fine. So again, ultrasound readings can be off quite a bit. So amniotic fluid changes, fluctuates, especially towards the end of pregnancy. It will actually drop closer to the end of pregnancy. You can read all about this in the article I will link below. Again, I'm not giving medical advice. I'm just sharing research I have personally done with you guys and want you to jump into your own research. But an automatic induction call for low amniotic fluid is an option you do not have to agree to. Always do your own research here. I hope I've presented a few more options to you guys of things that you might be presented with in the later part of your pregnancy. This next video will be leading on into birth and then after birth and the postpartum time. So I'm very excited to continue to bring along for this pregnancy some of the options that I've kind of been weighing upon in my pregnancy. Hopefully you guys have been becoming more critical thinkers and thinking about these things for your birth and your pregnancy. Again, leave me any questions below, any more topics you want me to delve into. I will try my best to bring y'all information and resources as much as I can. So I wish you a happy and healthy pregnancy and I will see y'all in a future video.